Hi, Dr. C here. Today we're going to talk a little bit about medicine. One of the newer things that are on the market now are analgesic patches. It doesn't necessarily have to be analgesic patch. It can be a patch. And I'm sure you're familiar now, at least those of you who have, say, back pain or certain joint pains and all, you've probably used some of those patches. A lot of the patches now are not even by prescription. You can just buy them right over the counter. Well, let me tell you a little bit about patches themselves. I should have brought a couple of, I knew I had forgotten something when I got here today, and I just forgot to bring a couple of patches with me so we could show you physically, if you're not familiar with the patches, what they look like. But nevertheless, we're here, we don't have it, we're still going to talk about it. 20% of people have chronic pain in the United States. 20%. And when you figure how many millions of people are in the United States, that's a lot of people. Now, with the big fuss about opioids and all these different alternatives for some pain relief are obviously doing pretty well for themselves. And that's where really the patches have kind of come into focus a lot more now that we're dealing with a lot of the alternative pain relief things that are out there. Patches have been around for a long time. You remember the very first patch that ever came out? It was for motion sickness. Those little scopolamine patches, what you did, you put it onto the back of the ear before you took off on that plane or your long trip and all, and that scopolamine helped to keep you from getting motion sickness. That was the very first patch that ever came out back in 1979. In 1981, they had a patch that contained a birth control, for example. So they had an estrogen. That was the very first estrogen patch that came out. And then subsequently, they then had the birth control patch as well. That had two ingredients, two hormones in it, just like if you took a pill. And so, given that history back to 1979, we've had a lot of advances. So I thought it would be a good thing to talk about some of the things that finally get put into pills or put into patches. I got to get the pills out of my mind here. I'm sorry. Patches. And describe a little bit first about the patch itself. What constitutes the patch? Well, first of all, there are many different types of patches that are out there. They all have a similar being, you might say. They all have certain properties. First of all, they all have to have a liner. The liner is the covering over the active ingredients that are in that patch. Usually it's just a cellophane type thing, but that protects the material that's in the patch. So you got a liner. Also, you need a good adhesive. And there's three types of adhesives that are used in patches. You can use a silicone-based adhesive. Usually they use a polymer or a resin, whatever, but it's a silicone base. You can also use acrylics. Acrylics are generally what they call monomers. You put a few monomers together, you have a polymer. That's basically what the acrylics are. And they are an adhesive as well. And then finally, you have what's called PIBs, polyisobutylienes. That's not as commonly used, but that's the third type of adhesive. The value of that is that at least the PIBs hold the material in a lot better, as well as stick a lot better to the patient. So we have liner, adhesive, and now you need a filler. Why do you need a filler? Because a lot of these things just have the drug, and the drug may not be a lot. So you need something else to go with it, to fill it. That's what happens with capsules and pills. They use a filler because that active ingredient may only be a very small amount. And you need to have at least something substantial to fill that thing. So they use a very neutral filler. And now the drug, whatever the drug happens to be. Usually, what I'll do is I'll describe a little bit about where that drug goes in a minute. Then you have a membrane. Why do you need a membrane? Because some of these patches have 2 or 3 layers to it. And there's a little membrane in between the layers for those who have, for the patches that have multi-layers. If it's a single layer patch, you don't need that additional membrane. Also, then you need a backing to it. And the backing is usually, that's there to protect you against whatever's on the outside. Because these patches are going to be on for at least 12 hours. Some of the patches go up to 4 days, but at least 12 hours. And so you need to have some protection against that outside environment. You don't want it wiping off on your clothes. You don't want it to leach out from the undersurface of this thing. So you have a good backing to it. And also, you may have to have an enhancer. What's an enhancer? To promote the activity of that drug when it comes in contact with the skin. So, there were a couple of drawbacks when they first started producing these patches because the skin is lipophilic. You know what I mean by lipophilic? It's a fatty type thing. Fatty substances could get through, but not water-soluble substances. And so, that made a big difference. If it's lipophilic, you want that stuff to get through. You want that drug to get through to your system, so get absorbed. Because that's really the purpose. Get that stuff absorbed into your system. And so, those are the components of the patches. I mentioned now that there are several types. The single layer, multi-layer, and then there's a reservoir type, where you actually put that drug into a little reservoir in between 2 of the membranes of that patch. So there are basically those 3 different types of patches that you can have. For example, the nicotine patch. That's the highest selling patch on the market right now, nicotine. And so that particular patch does use that reservoir component. You can also get different types of patches, nitroglycerin patch, for example. That's still readily available. You can get an Exelon patch, which supposedly foregoes the progression of Alzheimer's. I don't think there's anything on the market that's going to, at the present time, that's going to cure Alzheimer's, but the patch is out there. People use it. You can also get a B12 patch if you wanted to. Much easier to just take the B12. Some people like to get the shot, but hey, that's their prerogative. Nevertheless, so those are the types of different kinds of patches that are out there. So let's talk a little bit about the drug that's used. There are several different types of drugs that are used in these patches. Number 1, lidocaine, which is a local anesthetic. you can have either a 4 or 5% lidocaine patch. The 5% are by prescription. The 4% you can buy right over the counter. How does it work? Lidocaine binds to a defective cell. Now, what do I mean by that defective cell? I mean the little nerve endings that may be irritated. So it's defective. The lidocaine binds to those and will numb that area. So, in other words, lidocaine is a very good alternative for pain relief. So, they call that irritated nerve, they call that sprouting. That's because there's these little dendrites that are irritated and they cause the pain. So, just to give you, I want to give you as much information as you can. So, why 4 or 5%? Because that's the ideal percentage in order to achieve some pain relief. So that medicine, that lidocaine, gets absorbed. And it does take care of neuropathic pain. That is that irritated nerve ending. How effective is it? Well, it's hard to get accurate numbers, but most of the studies that have been done show that it is effective probably up to 40% of people who use the patch. Definitely worth a try. Definitely the first step before you went and considered to have an alternative. There are some drawbacks to using that patch. Number one, you can get skin irritation to any of those components that are in that patch. In fact, that's one of the drawbacks, one of the major ones that people complain of. So you can use a different area of the body, but each one of those, if you have a chronic irritation to that patch, each one of those areas are going to have to heal. Also, there's variability in the thickness and nature of the skin. You want to put it onto the thinnest part so that it gets absorbed a lot easier. Good. So there's different absorption rates depending on the thickness of the skin. There's a limitation at first. At first, there was a limitation in which medicines you could put into a patch. Remember I told you that if you use the water absorbable, it gets absorbed pretty easily. That's what they use in the moisturizing creams and all. The lipid, if it's fatty, it isn't going to be absorbed as easily. Also, if you have any metal in that backing part, that's on that part that's protecting it from the outside, any metal that's in there could cause a reaction. You could be allergic specifically to the metal, for example, or you can't have an MRI if you have that patch. I got to take that patch off. You can't put a heating pad on it because the heat will then very rapidly use up that medication, plus you'll definitely get a skin irritation, even a burn, with simple heat. So you can't use any heating pad on that as well. So that's the lidocaine patch, the most commonly used analgesic patch. What else is used? Well, there's a thing called capsaicin. That's that resin that you get from the hot chili peppers, capsaicin. You say, well, why is that useful? Well, it's useful because it does have an effect on those neuropathic fibers, especially in people who have things like neuropathic pain from shingles. The capsaicin seems to be the best type of patch to use. Yes, it does cause that feeling of heat. That's one of the ways that these patches work. They work by causing some heat. They call this a counter-irritant. So that's exactly how it works. What else? Well, the other thing that capsaicin does, you can use a 0.625% patch with capsaicin, which is in a cream form. So they mix that resin with a cream. That does affect the autonomic nerves in the skin and will help. Okay. The third thing that's used is methyl salicylate, or MS, methyl salicylate. It comes in several different strengths, 0.04% to 20% methyl salicylate. And you remember that term salicylate because that's what aspirin is a salicylate as well. So that particular thing is in, say, oil of wintergreen, oil of peppermint, that type of stuff. That has methyl salicylate in it as well. That is very readily absorbed in that patch. So, given that, you do get that heat sensation as it's being absorbed. So we call that a rubefacient effect. Rubefacient. That redness that can occur in that underneath that patch, those are the little blood vessels that are dilating. That's why they call it ruba, which is red facient, causing that redness from the dilated blood vessels. Those blood vessels pick up the medicine quickly. Okay. That's methyl salicylate. Menthol. Menthol is used in patches. The strength usually goes anywhere between 0.2% to 16%. Menthol gives you that particular odor. Remember I told you about with the CBD, the terpenes? The terpenes are the things that cause the scent that it has. And so menthol is a particular terpene scent. It's a product of the peppermint plant. And so what it does, it increases the blood flow to the skin. Excellent. That is a good thing. So that's why menthol is a very, very common product to find in those patches. It is a vasodilator. And you can use up to 4 to 5% and get that effect. For example, you've seen those patches that are called icy hots. Icy hot. It's not that it's hot, because menthol causes a cooling sensation. The skin temperature actually does go down. And so that's how it works. That cooler temperature enhances the penetration of that drug. So far we have lidocaine, capsaicin, methyl salicylate, and menthol. We also, if you see in your patches, you could also put in camphor. Camphor, of course, is very odoriferous as well, has a lot of terpenes, and you can use varying amounts, concentrations of camphor in there. A very commonly used patch is called Salon Pas, S-A-L-O-N, Salon Pas. That combines methyl salicylate, 10%, and menthol, 3%. And it's given to you for pain cessation, pain relief. That is the only FDA-approved patch for pain relief. All these other patches that I talked about, like the scopolamine patch, etc., those are all approved for a particular reason. But for pain relief, the Salon Pas seems to work pretty well for most people. At first it came out just with small patches, and now they have larger patches as well, which gives you the relief. Because you may have these irritated nerves in a fair area of the body. So, salon pas. So what other types of patches are out there? Well, we also have patches that produce irritation, like the capsaicin. That produces the irritation. What does the CDC say about any of these things? Because they're the ones that are supposed to be monitoring all these things, the CDC. First, don't use a tight bandage over the patch. No pressure. If you put pressure on, it increases the absorption, and so they don't last as long. Don't apply to an open wound. Keep it away from your eyes and your mucous membranes. And never, ever apply local heat, like a heating pad, over the patch. Those are the drawbacks. I want to spend a minute or two on the newest patch that's out there, which is the CBD patch. Wow, CBD patch. That sounds interesting, doesn't it, huh? Well, that CBD patch is, like I said, it's the newest one that's on the market. And there's two types of patches that are there. There's probably, I would say, almost 20 different places now that make CBD patches. And what they do is they can use either a reservoir type of patch, which is the material that's in between the membranes. So they put that material in and it gets slowly absorbed. So the CBD patches last between 12 hours all the way up to 96 hours with the ones that have a larger reservoir. And you absorb it. The advantage is that it gets released slowly. So over the course of time, you have a very constant blood level of your CBD. It's actually a very ingenious way of delivering the CBD. You don't get a quick rise and a quick fall. You get a very constant level of CBD. And so that's how the patch really began to take off, because it did have a nice even balance of your drug during that time that it's on your body. And so subsequently, they've done some more research on the CBD. And remember, I told you CBD is an oil base. Oil. How do you convert that into a water-soluble type that would get easily absorbed through your skin? Well, they use two different methods. Number one, use an ultrasonic machine. Shakes it right up. And the longer you shake that up, the smaller the little particles of oil get, until you get really just micro little globules that are totally suspended in that water. Totally suspended. In other words, you put it out, let it sit for a while, it isn't going to settle. They are suspended in there, and they get released very slowly. The other method is to use a turmeric base, mixing it a certain way with the turmeric, the curcumin that's in the turmeric, and that breaks it down into the tiny absorbable particles. Again, why the CBD better in a patch than if you took it by mouth, for example? Another way of delivering it is just take the oil, put a couple drops under your tongue, hold it there for maybe 15, 20 seconds, and then swallow. How much of that do you actually absorb? How much do you get? It's only estimated you get about maybe 10, 15% at best of the amount that you put in. With the patch, hopefully you can get up to almost 100% of that. Another advantage to the CBD patch as opposed to just using CBD oil. So there is an advantage. Also, the CBD people, they're not sitting still, believe me. There's tremendous amount of research being done now. There's two schools of thought with CBD. Number one, using hemp, they can isolate the CBD and concentrate that CBD down so that you can get a 99% pure CBD. Only CBD. They take everything else out. All the other cannabinoids, the terpenes, they're all taken out of there. And now you get just pure CBD, 99% pure. And they put that in the patch. That's one school of thought. The second school of thought is that you need to have the full spectrum CBD. You need to have all of those other cannabinoids, all of the terpenes, the flavonoids that are in there in the first place, full spectrum, everything in there. You need that for the CBD to work well. Well, there are patches that do that. They give you the full spectrum CBD in patch form. Which is better, the isolate or the full spectrum CBD? I don't know, because we don't have all the data back yet to see which is better in comparison. It's going to take a little time until we finally get results that mean something. Right now, all we have are anecdotal. In other words, individual patients who say, boy, I really love this stuff. This worked for me. I'm pain-free, that type of thing. That's anecdotal. You need to have a study testing that stuff, first of all, against a placebo, no CBD, and against the other type of CBD, the isolate. So, again, using those two different things, that's the CBD patch. And so, knowing that, I would guess that probably the CBD patch has a good future ahead of it. But again, remember, CBD is only approved for one medical reason, and that is for pediatric seizures. That's it. Two syndromes, Dravet syndrome, that type of thing. Very few kids actually have that. That's the only CDC approved by the for CBD. Okay, so that's a little bit about patches. I thought it'd be very interesting. That's why I wanted to present this to you, because we're using these more and more, and most of them you can get right over the counter. First of all, with any medicine, you don't take it unless you have a specific reason to use it. And then you have some idea whether it's working or not. If you're just taking it for pleasure, not something you want to do. So have a specific reason, use the patch according to directions, put it on for the 12 hours like they say, or whatever number of hours they say, take it off, bathe, use another patch, that type of thing. Very good. Okay, this is Dr. C, and I enjoyed talking about patches with you, and next time we'll have another discussion on some medical topic. Have a nice day.